Welcome to this week's episode of Mind Movers, the mental health podcast, as a little side from Dental Leaders, which is my favourite. And today we have Dr. Yusra Al-Mukhtar, and it's so exciting because she's actually her sister, Zainab, who is a good friend of mine, and her mother, Dr. Farida.
Yeah.
She has also been on the podcast on the Dental Leaders one. So we have a whole family gathering coming here.
Family affair.
Scroll back to the previous podcasts with them because people love those ones. And I think you're a real force as a family. Dr. Yusra is an award-winning facial aesthetician who's actually a dentist, and we'll get into that. So she's GDC registered. She has an award-winning practice in Liverpool, which practices facial aesthetics and dentistry. She's also a mother of two, married to a psychiatrist.
Correct.
Yes, so medical. Of course, the Arabs like to marry my dad and mum, doctors and everything like that. So I'm well versed with that. And today we're going to have a really interesting discussion. The reason why I wanted to invite Yusra on the podcast, because I don't often invite healthcare professionals, is because I think that her platform offers more than just facial aesthetics and dentistry. And what I mean by that, it is a platform that represents humanitarian causes. It also talks about beauty, fashion, and so forth. And I think that when people show that diversity, they develop a different kind of following. And you can have very interesting conversations about vulnerability, about hope, about love, about dreams, about controversy. So Dr. Yusra for me was the perfect person to invite. So welcome.
Thank you so much. What a lovely introduction. Thank you.
I told you, I always make sure that I speak the truth when I'm speaking about
The
people.
only thing that I would add is I have a clinic in London and Liverpool.
Oh, amazing. Well, you know what? To be fair, I have actually visited your clinic in London, but I just assumed when you had opened up the flagship in Liverpool that you'd left that. So,
Oh, no.
So you still got
between
that.
the two.
So yeah, okay, amazing. So, Yusra, I like to start things from the beginning. Could you please tell us a little bit about your background, where you're from, where your family are from, and how you ended up in the UK?
So my dad is from Iraq. He's actually half Iraqi, half Azerbaijani. My mum is Yemeni and Turkish.
Love.
And we were born in Scotland. Myself, Zainab, and I were born in Scotland. So I was a wee girl. I stayed there until I was 6 and then moved to London. Stayed in London until I was about 9, and then we moved to Oman because my mum was a dental surgeon as well. And her passion and interest and focus was implantology. So 30 years ago, I'm giving away my age now, the dental implants was not a thing in the Middle East. It was not a thing in Oman. So she had an opportunity to bring it to Oman. And so obviously she didn't say no to the opportunity. And we went there and it was incredible, like best years of my life. We stayed there for about 3 years and then came back to London and stayed here until after I got married and then, moved begrudgingly to Liverpool.
Oh, wow. I was thinking you have such a nice international accent. I do love a Scottish accent,
Yeah.
but, I definitely picked up. I came here when I was 5, but I was like, it always sounds so English. When I see. That's amazing. And your parents, why did they choose the UK?
Oh, great question. So my dad was a surgeon in Iraq.
Okay.
And he worked there and did a lot of his training there. And over there, they have something called conscription, where at the time you had to be enrolled in the army. So he was an army doctor. But he had the opportunity to study abroad. So he went to Dubai and he studied there. And then he came to the UK to complete his studies. And my mum had done her dental surgery, her undergraduate degree in Romania.
Wow.
It's called stomatology. And after that, she moved to the UK because her brother was a surgeon in the UK and he said, come here. So she came here and she met my dad while they were both on call. My mum did oral maxillofacial surgery.
You're like my parents.
Literally, she says she was on call. She fell asleep in the mess, in the doctor's mess. And she woke up and there was an Arab man staring at her. And that was my dad.
I love it. I love that so much. And how was life growing up in the UK for you? Well, Scotland first, actually. It's not even the UK.
Amazing. I absolutely loved Scotland. We still have a house in Scotland. I have a real affinity to Scottish people. I identify as kind of Scottish as well.
I love that.
Yeah, I think, if they ever break away, then I'm in Scotland.
Yeah.
Like the free education for our children. So, yeah, I mean, I loved it. I enjoyed it, but I was 6. And then in the UK, it was all great. When I went to Oman, that was great as well. I kind of knew that I wanted to go into healthcare from quite a young age. Partly, I guess because of exposure to my what my parents were doing. They were always in the service of others. And that impacted me. But also I had an accident when I was 8 years old. And that ended up causing a facial deformity because I cut my lip from this corner right down to my chin. So I had a really prominent scar, and people would always ask me about it, literally until I had scar treatment. So my whole life, people would ask me. And I remember actually after the accident, I wrote a letter to the surgeon. I said, I'm going to do this one day. I'm going to help others. So I knew from a young age that I wanted to go into healthcare. And then when I came back to the UK from Oman, I went to a all-girls school, a Muslim school in northwest London.
Okay.
And then I went to a Jewish school for my my A-levels in Golders Green.
Which one? I knew all the like...
Henrietta Barnett.
Oh my God, know it. I was so not smart enough to get in there. They definitely rejected me. I was definitely not, but I knew Henrietta Barnett really well.
Yeah.
Because it was the dream. My parents really wanted to go. I was just not a smart child. I had to work really hard, but you know, I made it when I went to school. But that's incredible. So you must have been an incredibly academic child, because Henrietta Barnett was very academic.
Yeah, it was competitive to get into. Was I academic? Not until I moved to Oman. I think up until then I was kind of climbing trees, jumping off walls, not really interested in academia at all. And I think the turning point was two parts of my story turning point. One was when I must have been around 9, before the accident. And was it before? Maybe it was after. And I came home and my mum said, actually we got in the car, my mum said, okay, show me your reports. And Zainab, my sister, showed the report, and she was like, you know, she was studious at that time. And she got A's and B's. And then my mom said, show me a report. And mine had like C's and B's. And she was like, well, okay. And she didn't say anything. She didn't reprimand me or shame me. Literally, she just went. And I said, Mama, I think they swapped my report. It's a mistake. And she was like, oh, okay. It's a mistake. She's so smart, by the way. Like, I really look up to her and how she raised us, because she knew that I was embarrassed. That's why I said, this is not my report. I felt shame. And so she recognized that immediately and went, okay, that's fine. And we used to go to McDonald's after getting our reports as like a treat. And I thought Mike's still going to go to McDonald's as a treat. And she went, let's go to McDonald's. I was like, great. So we went to McDonald's, came home, and then my dad, surgeon, Arab, you know, Iraqi, anything less than 100% is not good enough. And bless his heart. And he came home and he looked at my report and he goes, why is this your report card? And I legged it. I ran upstairs. And my mom said to him, Amir, his name is Amir, don't tell her off. She already knows and she's going to do this on her own. And so me as an 8-year-old heard, oh, I need to fix this on my own.
Yeah.
So that's when I started to hold myself accountable and actually start to care about academia. Before that, I really was just literally, I'm not even joking, climbing up walls and getting stuck in trees.
Yeah.
I was very sporty. And then I think shortly after that we moved to Oman, and in Oman there was an entrance exam.
Yeah.
And, you know, before that I didn't really know much about exams. So when we had the entrance exam, we got in, but it was very difficult. It was a challenge because my mum had a decision where she could either have put us in the expatriate classes where we'd learn everything in the British curriculum, or in the classes that everyone else went to where they would learn history, geography in Arabic, which was hard for us. And she was like, no, you can do it. And so I thought, oh no, again, we're going to have to do it. Because there was this unwavering belief. It was, yeah, you're going to fix this. You're going to be fine. And so I think is when I became super academic and studious. Amazing.
So I think it's interesting that you say that your mum was that helpful buffer. I think it's really important because I've had my dad on the podcast as well, but there was definitely like this thing of my parents couldn't afford to send us to private school, so they worked really hard to send us to private school. So you had to do well. It just wasn't an option. And you often see, like, there's this Arabic guy that I actually follow, and he does this meme, and he was like, point of view, when your parents see you get 93%, he's like, where did the 7% go? You know, like, it's just classic, you know. So I absolutely love that. Yusra, on another podcast, I heard you speaking about your father and where he was from and how nerve-wracking it was, because at one point he actually had to leave the UK and return back home. Do you want to tell us a little bit about that?
Yeah, so that was all after the Iraq War, the invasion of Iraq, which happened after 9/11. So I think I was must have been around 16 at the time. And I remember the country became very polarized and anti-Islamic sentiment started to happen because it was attributed to these terrorists who were from an Islamic background. And I remember walking in the streets to Henrietta Barnett and being told to F off back to my country.
Wow.
And being really confused as the 16-year-old thinking, what do they mean? And where is my country? I was born here. Where do I F off back to?
Was this post 9/11?
This is post 9/11.
Okay, fine. Was 9/11 also difficult or not during that time?
Yeah, it was difficult because of it was an extremist terror attack.
Yeah.
It was difficult for every human being. It
Yeah.
was scary.
Yeah.
But then what also happened was stigmatization.
Okay.
You know, suddenly it was, if you see a man with a beard and a bag, be careful. And a stereotype started to form. And that stereotype continued and progressed into, if you see a woman with a scarf, she also doesn't belong. She's also other, you know? And so I think and a lot of Muslim women who wear a scarf and can't hide their faith were subjected to attacks. And then there was this claim of weapons of mass destruction, which later was found out to be a lie. But based on that, Iraq was invaded. Okay. And when it was invaded, one of the, lots and lots of bombing, obviously carpet bombing, and lots of people were killed. And there was a looting and chaos and so on. And there was a destruction of the healthcare system. Now, my dad's a surgeon. And so I think he immediately felt a sense of responsibility and duty to help. But also it hits really close to home because his brother, during this chaos and anarchy and, jails, people busted out of jails, criminals that should have been in jail were no longer in jail, people were looting, it was just chaos in Iraq, kidnapped my uncle, so his brother.
Wow.
And held him for 5 days. I said in my podcast stream, I was corrected, it was 5 days. And he was tortured and beaten. And then the brothers all came together and raised money to get him out because he was held ransom. And that's what they were doing at the time. They were taking people that they felt had money or had affiliation of people who could pay and hurt them and held them ransom. So he was one of the lucky ones who lived. And he was dumped in the middle of the desert and really left for dead, picked up by someone random, taken to his house, and his family didn't even recognize him. His wife and his children didn't recognize him because he was so badly beaten and swollen and bruised. And so I think that was really traumatic. That was traumatic for us. That was traumatic for my father. And they were then expatriated and brought to the UK as refugees and lived with us for a while. So we heard kind of by proxy what it was like in war. My cousin talks about how the house, the lights went off and the bombs went off, were going off, and the windows shattered, and how they looked outside the window and they saw dead bodies on the ground. These were the things that we were hearing about at that young age. And shortly after that, my dad took a sabbatical from the UK, his position as a surgeon, and moved to Iraq to work as a health advisor in the largest medical city complex in Baghdad, and to basically rebuild it. But even that was dangerous, every time a bomb went off.
How did your family react to that decision? Like your mom and you guys?
So it wasn't discussed with us as children. We weren't, it wasn't an opinion of, are you okay with us going? It was, obviously a discussion had happened between himself and my mom. And my mom was supportive but scared. So she lost a lot of weight while he was away. She had to raise 4 children by herself. She didn't know if her husband's coming back. Every time a bomb went off, she didn't know if her husband was dead. So we'd always be waiting for a call to say, is he still there or not? And in that time, he had bodyguards because he worked as a prominent, he's a health advisor. Sure. And his bodyguard was killed. So it was real anarchy. He was guarding outside his office and he opened the door and he was gone. And they found him shot dead in the basement of the hospital. So these are the kinds of things that was the norm. And so it was a really stressful time.
I really appreciate you sharing that. And one of the reasons that I ask is because I kind of had a memory blank. So I was actually born in Saudi, which people don't know. So my parents met in the hospital in Saudi, similar. And we lived in Aramco where I was born. So again, it was like that community complex sort of life. Then we moved to Bahrain because that's where my dad got his second job. And my sister was born in Bahrain. And actually it was during the Gulf War. And I remember hearing the raids, and I remember hearing like the sirens and stuff as a child, and all of a sudden at school I was running down the street with gas masks. But I had this like memory blank, and the memories only started coming up quite recently. So it's really funny as children how we guard ourselves from trauma. Like I just didn't remember.
Compartmentalize.
Totally, but that's pretty traumatic. Imagine being at school, which me and my sister were. I must have been about 4 years old. Tanya was like 1.
And you still remember that?
Yeah, and I remember my nanny like coming and carrying her, and the masks being put on and stuff, you know. And we were just living like that. And obviously when I came to London for many, many years, I just didn't think about it. And now I have memories, and I can remember quite distinctly running. But it's funny because I find when I'm in physical situations of stress, so for example, I don't know, like in a car that's driving very fast, or skydiving or bungee jumping, I actually don't get scared, but I'm more scared of emotional threats to my safety. So I'm the kind of person that will panic about how people react if I upset them, about confrontation, about what people think of me, as you know, all these different things. But when it comes to physical stress, and I wonder somehow if that is related to the types of things that I've grown up with. So
that's a question for Hassan, psychiatrist.
Yeah, I absolutely love the fact that he is a psychiatrist. Did that teach you a lot in your relationship?
People always ask me, does he read my mind? And I say, I wish. I wish, because the socks still end up on the side of the bed and not in the washing basket. So if he read my mind, that wouldn't happen. But he's a very, very patient, understanding man. You know, he's incredible, and he's taught me a lot in raising our children as well. And his passion is child psychiatry and
I love it.
Trauma management. He deals with a lot of children who've undergone trauma, and adults who had unresolved trauma as children. So that's his specialty.
And does he like combining the medical aspect with the psychological? Because
very much.
My experience with psychiatrists before have been very much like, let's go down medication route, which I think is a band-aid and not getting down to the root cause of things. So I'd like to think psychiatrists, with the new innovation of thinking, like Gabor Mate, who I know that you're a fan of, that they're actually understanding. We can't do that. We can't just numb people.
That's kind of their role, right? I mean, if you want to talk to someone, you can talk to a therapist.
I don't know. Yusra maybe can help us understand
that. The psychiatrist's role is kind of to bridge the medical with the...
So psychiatry is a medical specialty, but I think this is an older generation versus younger generation psychiatry bridge, so to speak. So he always says, I'm a very psychologically minded psychiatrist. He will sit there for hours talking to his patients. And I think he's quite against just putting this Band-Aid on. He describes it in the same way that you just have. You cannot treat body without understanding mind, and you can't treat mind without understanding body. And that holistic mindset is something that I have incorporated into my facial aesthetic practice. And that's how he also views his psychiatry. So when he's treating patients, it isn't what's your symptoms, let's treat your symptoms. It's let's go back to the source.
Yeah, which I think is massively misunderstood within our profession as a whole, because we constantly, and I think as scientists, we treat it in a very scientific way. There's a problem, try to find something that's tangible and that you can see as the solution. And when we look into it deeper, we recognize now that there are so many different factors that contribute to somebody's well-being. I think there are more severe diseases, and unfortunately, when you've got to the point of like severe bipolar or severe schizophrenia or any of those diseases, that's when you have to know that you have to actually implement different modes of treatment to also protect the public, protect people around, etc. And I think that's where it becomes a little bit more complicated.
I mean, that's a medical diagnosis and may require medical intervention. And also, adults are different to children.
Correct.
When you're dealing with an adult mind that has already set and has preset schemas and experiences, it's a lot harder to reverse engineer. When you have a child who's undergone trauma, you can help them to understand that trauma and not manifest it so that it means something and ends up incorporating and impacting their life decisions. So if you get in there early, you can actually, in his view, and this is what he says, is change the trajectory of that child's life so that the trauma doesn't define them. So that psychosis or that bipolar may have been initiated by a trauma or triggered by a trauma. It may be a hormonal imbalance, a neurotransmitter imbalance, a whole host of different things. There's genetic predisposition. But as dealing with children is different with dealing with adults, because you can change the line or the path that they go. They travel through.
Yeah, for sure. I am still reading the book The Body Keeps the Score.
Oh yeah.
One of my favorite books, because it talks a lot about science and all this stuff, and how the body really does react to the mind, as it were. And unfortunately, as you know, a lot of children aren't in a position to be able to have access to these people. And by the time they can access them, they may have gone into teenagehood or adulthood. And, that's a whole different discussion. But it's so complex, because we try to treat psychiatry, psychology, psychotherapy as almost a sort of, let's go into a system, and dare I say, something like the NHS, where they have limited resources, funds, people, etc. Let's go into like a part where we can treat as many people as possible, and you can understand they have limited time, money and resources, but it's not necessarily the best way, because these things are so multifactorial and everybody's so individual to their response to these different things. So amazing what your husband's doing.
So where did you study dentistry?
King's College London, but I also did an intercalated BSc at Imperial College London. So I graduated from both.
What were you like?
What was I like as a student? Geek. I was a real geek.
Were you?
Yeah, massively. I was a real geek. I was really into my studies. I really wanted to do well. I did do well, quite well, from undergraduate level. I was that one coming out thinking I failed, but I would get distinction, which my sister would always be like, oh.
Were you at the same time?
No, I actually, she's a year older than me, but she took a couple of years out because she went down she started doing optometry, and then she decided to redo her A-levels, and then she came back into dentistry. So I ended up starting dentistry first. But because I did an intercalated BSc, I then came down. So we joined years.
No
so we
way.
did year 4 and year 5 together. Yeah.
That's amazing.
Yeah.
So
we graduated from dentistry together.
So let's talk now. So, you clearly were a superstar at dentistry. How did you end up in the realm of facial aesthetics?
Great question. So I always knew I wanted to do surgery. I was really inspired by both my mum and my dad. They were both surgeons.
So why didn't you choose medicine?
Because I actually was going to choose medicine. And then at 16, I went to watch my dad in theatre. And he was working in Scotland at the time. And I fainted in theatre.
Really?
Yeah, I was so embarrassed. He was doing like a hernia operation. And he had all these, the guts and the intestines out. And he was talking about what they were going to cook in the evening. And I'm like, who is this man? And then the next patient, which is when I fainted, was a patient who he was taking out a cyst on their hand. And of course, they stopped the blood flow in order to operate. And he was trying to teach me about the tendon. And he was like, look. And I'm like, well, where's her blood? And he was like, no, don't worry about that. And I was like, oh my God, she's dead. And then I fainted.
Oh no.
And then I stayed in the hospital for a long time with him. I was there for like a couple of weeks. But I realized that with medicine, you're only ever treating sick patients. It's not like dentistry. That's
exactly the reason I chose dentistry. Because I said, you always see people when they're sick, and it's just, I don't want that.
Yeah.
Like the relationships you form in dentistry.
Exactly.
Like I see patients, yes, you can change their life, but you see them every 6 months. You're doing preventative care.
It's weird, we talk about medicine or dentistry because they're totally different to each other. I'd say dentistry is closer to hairdressing.
What? So funny.
Than it is to medicine.
Apparently the original dentists were hairdressers. Did you know this in like the 17th century?
It's closer to hairdressing than it is to medicine.
How?
Because it's a similar life. You've got people coming in.
Right.
You're seeing them regularly. Like everything about it is similar to being a hairdresser.
Wow. I reject that.
What's wrong with hairdressing? What's wrong with hairdressing?
There's nothing wrong with it. Nothing wrong with hairdressing. I couldn't be a hairdresser.
It's a totally different thing.
I disagree. I think.
I actually think we're specialists in medicine. I think we're specialists.
You're hyper specialized in medicine. First of all, it's not that there's something wrong, but there's a big differentiation. Dentistry is a doctorate degree, so to speak, Bachelor of Dental Surgery. You come out being a doctor in dental surgery or in dentistry, and you are treating patients who have an absence of health. You're treating disease. You're nurturing them back to health. You're dealing with huge risk. It's a skill set, and that's why you have something called license to cut. You don't have license to cut tissue, not hair. Hairdressing is completely different.
I'm saying the day to day.
The day-to-day is very different. How
It's-
many hairdressers pick up a drill and have to deal with blood and saliva?
You know, I've been a dentist. I know what it is to be a dentist.
I think he means the regular like clients coming in, like so they come in for
Look,
maintenance.
my brother's a doctor. Yeah, his day to day is completely different to yours. Completely different. He works in the hospital. You've seen your dad.
Yeah,
You've
but
seen
you
your
see,
dad.
again, so
It's a different
doctors
thing.
can be psychiatrists who have who don't deal with blood. Doctors can be general practitioners who don't
Anaesthetists.
Anaesthetists. So, yeah, so there's a variation of what being a doctor is.
Yeah.
This is just a hyper specialized form. So I hear your point. I just disagree.
Okay, so let's talk about facial aesthetics. Like, we haven't got into how you got into that. So yeah.
So then when I qualified from dentistry, and I chose dentistry for that reason, for the people aspect, to be honest, because I saw my mum always seeing patients and understanding their backgrounds and asking them about their relationships and their children and their marriage and their divorce. That's unique to dentistry, and I guess also hairdressing. And so then I decided, because my mum was doing a lot of implant dentistry, I was really inspired by that.
And that didn't make you feel sick. Like, you know, you said when you were watching the hernia and the tendons and all that stuff, you fainted.
Yeah.
That was fine, almost like being in
That
the
was
mouth.
fine. I think it was the concept of the person not speaking.
Yeah.
You know, it was like, it almost felt like they were not there and dead, and it felt like a violation to me.
Yeah.
And of course it's not. It's curing disease. But that's how it felt to me.
Okay.
I was too young to understand. And I
Sure.
even struggled when we did dissection, when we had to dissect. At the beginning, I really struggled with the concept of cutting people who were
Yeah, I didn't like
corpses. You know, I really, really struggled with that. But anyway, so then after I qualified, I went to my mum and I said, teach me how to do implants. And she just said to me, no shortcuts here. You got to go and do surgery like I did. So that's what I did. I went and I did oral maxillofacial surgery, and I ended up doing it. I did an SHO. Then I went back and I did something called core development post. And then I went back and I did another post. So I spent 3.5 years, and I became specialty doctor in oral surgery.
Yeah.
And then I got pregnant. And during my time in the hospital, so we were treating patients in MaxFax. You're treating patients who are trauma patients, road traffic accidents, oral maxillofacial cancers, but also those who have craniofacial, skeletal, congenital deformities or abnormalities, where they might have an underdeveloped jaw or an overdeveloped jaw. And how that is treated surgically is by breaking the jaw and realigning it. And this is, when you're talking about these surgeries, these are major surgeries, and patients often are young. They start their journey when they're 16 with the orthodontics. It's very multidisciplinary. And then they have their surgery around 18. And what was lacking at that time, and I can only speak about my experience then, not now, but what was lacking at that time was psychological support. So these patients were having surgery, waking up looking very different. And then we'd wire their upper and lower jaw together because they couldn't eat. They had to be completely immobilized. And they'd lose a heck of a lot of weight because they were sticking to a liquid diet. And they were utterly depressed, although objectively they looked better. They were depressed because they no longer recognized the person that they were looking at in the mirror. And there was no psychological support or adaptation for that process. And so they'd come in and you'd look at it from a dental aesthetic maxillofacial point of view and go, oh, brilliant result.
Yeah.
And they'd be like, I don't know who I am. I don't recognize myself. And it's not just that they were contending with, which was their self-image. It was that everyone around them felt at liberty to comment because it was such a drastic change. So people would say to them, oh my God, you had surgery, and what happened to your face? And so they would have to justify and explain themselves to other people while they still didn't understand it. So I'd be that doctor holding their hands and supporting them through that. And it just dawned on me one day. And actually, I did an audit in the hospital about psychological support, and that these patients need support. They're young. They're not fully formed adults in their 30s who can really contend and understand all the risks and the implications. And then I thought, there must be something that we can do non-surgically that can create similar change, but without the trauma, without the physical and the mental trauma. Then I started to Google, literally. I was on call one night, I was Googling online. And I read up about non-surgical facial aesthetics being used not in the field of vanity alone, but in reconstruction. And I do lots of rhinoplasties now, non-surgical rhinoplasties. That's where it stemmed from. And I thought, but at that time, we're talking 11, 12, 12 years ago, 13 years ago, facial aesthetics was Botox 3 areas, nasolabial folds, lip fillers. There was no real global understanding or discussion about the capacity to create empowering transformations, reconstruction. It was more rejuvenation. So anyway, I found a course that taught doctors and dentists, and I thought, okay, this is suited to me. I picked up the phone and I said, Zainab, let's go on this course. She was like, oh, Botox fillers, I don't know, I don't think so. I was like, no, trust me, let's go on this course. So anyway, I ended up telling all my friends and we went on this course together. There was like 6 of us. And now everyone has their own clinic. It's amazing. And that's how I started. But I always knew that my why wasn't vanity alone, and wasn't, I wasn't satisfied with the idea of doing lip fillers. Not that there's anything wrong with it, but it didn't align with my value set and what I wanted to provide to my patients. So
did you almost instantly leave dentistry after that course? Like, how was the transition?
No, I did it alongside. Actually, the first person I treated was my dental nurse.
Okay.
And then her mum, and then, it just kind of grew from there. And then staff at the hospital wanted it because they're like, oh, you do facial aesthetics. Can you get rid of my nasolabial folds? And I did it. But again, it didn't satisfy me. I couldn't have gone from facial surgery to that. And it just didn't satisfy me. And then, so I started to push boundaries and went on more advanced courses and recognized the potential of facial aesthetics to create incredible reconstructive change. And that's what we do in dentistry. I mean, what are we doing when people talk about cosmetic dentistry? All dentistry is cosmetic.
Yeah.
All dentistry is creating aesthetic change. And as you know, it's not vanity alone. Patients come with a story or a burden. There's a motivation of why they come and seek a smile makeover. It's because they feel held back by their smile. And in society, what we do when it comes to dentistry is we say, society encourages people. They go, yeah, you should definitely go and get your teeth whitened. You should definitely go and get your teeth composite bonded.
I always say this, it's more as a stigma. I'm like, people accept cosmetic dentistry as not really changing who you are. Like if someone said I'm getting braces, whitening and a bit of composite bonding, they're like, sure. Veneers is a bit more of a stigma. I think a lot of people aren't like open. But if you talk about the fact that you want Botox, filler, nose job, like any of that stuff, it's definitely more of a stigma around it. I think 100%.
There is, and there shouldn't be, because why are we as a society encouraging our patients to have orthodontic alignment, but the moment that they have a bump on their nose and they want to align that, they're not well aligned. That stigma is wrong. So a huge part of my work has been breaking down that stigma and changing the narrative that what we do is skin deep, because the reality is it isn't. And patients often come with burdens and stories, and the treatments enable them not to put a mask on, but actually to take a mask off and to live without feeling held back by their appearance. So I'm a big champion of that.
Another thing, but one of the stigmas of facial aesthetics, if you go and talk to my buddies and say, yeah, facial aesthetic, there'll be this immediate no thing. And it's because,
especially for men.
Well, it's a bit like cosmetic dentistry, right? If it's done badly,
it's done really badly.
Then you can see it.
Yes, absolutely.
Yeah. So imagine the number of people who've had facial aesthetic treatments
and very cheap.
It's done very well. If it's done very well,
you don't know they've had it done.
Most of my friends wouldn't know at all. So you only know it. You only realise it's happening when it's done badly.
Absolutely.
Right? And I was going to ask you, living in Liverpool.
Yes,
the aesthetic that people want up there is different.
How?
To sometimes what you might want to give them.
You're absolutely
right. How does that work out?
How do you deal with that?
So I moved to Liverpool in 2016 because my husband got a job in the primary mental health.
Were you both in London at that point then? Until that point, sorry. Yeah.
And I thought, okay, well, faces and teeth are everywhere. At this point, I was still doing both. And I quickly realised that the aesthetics in Liverpool is very different to London. And I love Liverpool. It's one of the friendliest, nicest, kindest, funnest cities.
Yeah, the people are wicked.
Amazing.
Yeah.
And by the way, the tide has shifted, but at that time, bigger was better.
Correct.
And the faker, the better. And they were very open about it. They have, with their brows, they have something called scalp brow. On a Friday evening, women go out with their curlers in their hairs. They are unapologetic about looking good, and good for them. But when it came to facial aesthetics, what ended up happening was distortion became the norm. And the lips would walk in before the rest of the face. And they would come in with already over-treated, overfilled lips and say to me, can I have more in? And nobody would ever say no. So they never heard the word no. And they'd sit in front of me and I would perform a holistic medical consultation because I have a duty to do no harm. And I would say, I can't do that because it's not in your best interest. And of course, remember, patients only see themselves as a reflection of themselves. They never see what we see. So I only see myself in a mirror or a photo, but you see me in real life. So they don't appreciate what they look like in all angles. They only see this 2D image of a 3D object. And so they don't realize that their lips are projecting more than their chin, or there's migration. And so I'd be taking these photos and videos. And you know, it was like in a big educational process. And patients would often say to me, if you don't do it, I'll go to skin clinic. And I'd be like, that's fine. You can go, but that's my reputation on your face. And then they would go and they would feed that back to their mom, their auntie, their friends.
And they'd be like, I agree.
Agree.
Yeah.
Right? And then next thing you know, that mom comes in and said, you said no to my daughter, thank you. And what can you do for me?
Yeah.
And so at the beginning, I really thought, oh, I will never do well in Liverpool because my niche is
natural,
look fresh, not fake, look good, not done. That's kind of my tagline. So, and that wasn't what they wanted. So I thought, well, actually, I'm not gonna do well here. But your vibe attracts your tribe, and I just created this niche of natural looking aesthetics, and it grew and grew and grew.
So now people come to you for it.
For that specifically. Yeah, and I think even
Rhona,
then
that must come up with you as well, right? Veneers.
So I'm really
people ask for big square ones.
No. I'm really lucky because just like Yusra, like people, but also like where I am in Chelsea, people don't want the fake look. And people come to me specifically for the natural look. Now, I do have another colleague of mine that works part-time in Essex and part-time at the clinic for me. If there are the few patients that do want the more fake look, they do go to him. And the more natural ones will go to like the bulk of my other clinicians. But on purpose, they're like, I like your work because it never looks done up.
Yeah.
And I think that, look, people go through trends. Like 5 years ago, people wanted like slightly faker composite bonding. Now people want more natural. It goes through the different waves of the different trends, but no one, especially like London, Chelsea, people want a fake look. They really don't want a fake look. And that's one of the reasons that they come to the clinic. And obviously it's taken me a really long time to find a good ceramist. You've met Simon, he's great. We've had to perfect things. And of course you'll have people that want to go slightly on the whiter scale, but I'll never let them walk around with like big, white, blocky teeth. I just won't.
Well, remember this issue of consent, right? And we had the model, your friend, the model, the guy, the male model.
Waz?
No.
Arthur?
Not your friend.
Paul
Scolfer.
Yeah.
Okay.
Paul Scolfer. He was maybe the 90s, the top male model in the world.
Okay.
And he came on the podcast. He was huge.
He was saying that he went to a cosmetic surgeon.
He had depression and he showed the surgeon
with
a picture
photograph,
of
and he said,
when he was like 20 at his peak of like modelling.
Yeah.
He said, make me look like this.
And then?
And the surgeon said no.
Yeah.
And he said later on he was so grateful.
Yeah,
because he recognised
exactly ethics. It's
but what if?
What if? Yeah.
Yeah. What if?
Yeah.
The person understands. The person knows what you're saying. Says, I want this.
This is a really interesting debate. And ultimately, there's a couple of things that we need to be, as healthcare professionals, we need to be cognizant of. And that is the sphere of influence our patients are exposed to. As Rhona said, trends come and go. Trends shift with time. And when we are creating permanent change or long-lasting change like veneers, different with composite bonding and maybe even different with fillers. But when you're talking about surgical change and cutting teeth down irreversibly, then there is a real question mark, and we need to think even longer and deeper about the potential to do harm to a patient. This is not timeless. So yeah, I hear that, and patients come to me and they say, I know, but this, I hear you, I respect your no, but I want it anyway. And I say, I'm the wrong shop for you then, because my work ethic and my professional integrity means that I need to have not just competence, not just confidence, but the courage to say no when it's not right for you. And if that is not in alignment with you, that's okay. Find another practitioner. That's how I approach it. What's your thoughts?
Well, I just think that, that the daughter test, yeah?
I know the daughter test. Would you do it to your daughter?
Would you do it to your daughter?
Yeah.
My view on that is it's your daughter's choice.
Yeah.
It's not your choice.
Yeah.
Yeah.
I agree with you.
As the professional, it's not your position to judge whether or not it's the right thing to do if you've done the right bit on consent. Now, I agree. There's a grey area. Yeah? The person might say, I understand, and doesn't.
Yeah.
Yeah? Or the person may have some psychological issue and pretend to understand. And, you know, there's all those things that you have to think about.
Yeah.
But this question of us as medics deciding, because, you know, at the end of the day,
patient choice.
Your view on what's acceptable and isn't is changing every day.
Absolutely.
You know,
but then you're the one taking...
people want whiter than B1 veneers.
Yes.
It's very common now. When I was cutting veneers, I used to tell them, no, don't even go to B1. You just get A1. You know? Because the culture wasn't to have super white teeth back then. And those things change.
So you're right. You're absolutely right. Things change. And I guess it's an arbitrary line that we draw, because this conversation and debate comes up a lot in facial aesthetics, because trends are changing and trends are changing quickly. And right now there's a new trend called beauty fandom. Have you heard of this?
What?
Beauty fandom.
No, tell us.
So beauty fandom is a concept of where there are people like in Lords of the Rings, where they've got like these pixie ears. And patients are coming in saying, can you give me pixie ears?
What?
Yeah, and so they want to look like a role model.
This actually is a thing.
This is actually a thing now.
So they want to look like fantasy characters, basically.
Fantasy characters. So this is called beauty fandom. It's something that has been recognized by Galderma in a new trends report, and is now a question about, okay, so is this doing harm to the patient, or are we accepting that role models are shifting over time and our duty is to give the patient what they want? And then I consider, well, what about Michael Jackson and Donatella Versace and other people who maybe went too far? Whose responsibility is it to say, I'm not going to do that to you? I don't know. The answer is I actually don't know.
I think it's
but I know where I stand on it. And I think it's kind to be clear. So when I do a consultation with a patient, I call it a same page meeting. And I start off by telling them what my goals are, what my views are, what my ethos is. And I say, this is a same page meeting, so we can decide if we're in alignment and if I'm the right practitioner for you. So if I'm not the right practitioner for them, it's kind to be clear and allow them to find someone who is in alignment and who's better suited to give them the desired outcome.
Yeah, that's a nice way of looking at it.
Yeah, I think that's a really great way of looking at it. And it is all about that alignment. It was interesting because I love going to my retreats, and I call myself a bit of like a retreat junkie, and I love spending time with people that do a lot of work on themselves. Yeah. And I'd met these practitioners. Some of them had actually given up medicine to become more holistic practitioners, actually. And I was like, I want to bring you to the clinic because I actually want you to be able to give an assessment to my patients, because I actually feel I don't get enough of a psychological assessment of my patient. When my patients come in for a consultation, granted they're an hour, but we usually end up going over the clinical stuff. Sure, we talk about what they do, maybe their relationship status. And over time, I build that rapport even more. But I think from the outset, it'd be really interesting to see someone's insights to their psyche and understand a little bit about their motivation for being there. And as you said, for dentistry, sometimes there's obvious red flags, sometimes there's not. I think red flags are always a sign of something unresolved within the human being. It makes it incredibly stressful for us as well, because unfortunately as healthcare professionals, we're not equipped, nor do we have the protection from anybody within our governing body or our realm or whatever it be that helps us navigate these issues. And I think, red flag patients or patients that are disgruntled are often treated with adversity and hate because, number one, they can make our lives more difficult. But number two, I think that they're not really understood in some way. And then you have people that also act as enablers. You have those, dental law partnerships, you have the enablers. But imagine if there was a real understanding of the psychology of those patients, because as Payman said, some patients project they want their happiness. You might not see it from the beginning, super nice. You give them what they want, they look amazing, but they're still unhappy because their life hasn't changed. Yeah. You're not responsible for changing their life. You know, and I think it would be really interesting if we integrated that more, which again is the psychotherapy side within what we do.
So can I tell you, I did a huge research study on this particular topic, on the psychological motivation for patients seeking aesthetic treatments and outcomes. And off the back of that, I actually employed a psychologist in my clinic for 5 years.
I just want to do it. I really want to do it.
It has been massively helpful. And then you need to bring Hassan on this podcast, because him and one of the psychologists, Dr. Lindsay Hampson, created a tool that practitioners in aesthetics now use. So, I'm sure it can be used in dentistry, which is a tool that assesses the framework, 7 domains of the patient's life, their appearance anxiety, the motivation for seeking treatment, and identifies red flags, so to speak, and concerns, and helps to differentiate between appearance anxiety, which is legitimate, and body dysmorphia, which is also legitimate but may need psychiatric intervention, and then has a pathway for which to treat them or refer them. So this has been instrumental, actually, discussed a lot in the aesthetic field. And I think there is something, now that you're saying it, it made me realize this is the same problem and concern in dentistry.
Because Rhona, you're really strong on EQ, yeah? Understanding the person's motivation. But if you're not strong on EQ, it'd be great to have a tool.
Oh, I'm so, and the thing is, I'm so sensitive to energy, but also because I'm an empath, initially I want to help fix people, and I'm like, oh no, I want to love you and understand you, and then I have been taken advantage of, in the past because of that. Also,
that is why I employed a psychologist, because I felt that my job role became part aesthetic practitioner, part psychotherapist. And I don't have the tools to understand that.
Exactly. A question for you, this is such a random one. Do you find, and I don't like making generalizations, I don't like making assumptions, do you find the London clientele different to the Liverpool clientele in terms of what their psyche is about?
Yes, in terms of demands and expectations. I feel like, and this is a generalization and maybe unfair, but just my experience is Liverpool patients, generally speaking, are maybe have more realistic expectations, actually. And they've seen really bad work. This is really obvious. So they really appreciate good work. And I think in London,
people are a bit spoiled for choice.
Yeah, that's reality.
Yeah, it is reality.
Do people bring you a picture of, Julia Roberts and say, make me look like that? Or whatever?
They used to. This is a thing. This is a thing that I used to experience, but not so much anymore. And I think the reason why is because there has been a real shift in the aesthetic industry, where patients are not accessing treatments for vanity alone, but as part of their self-care and self-rejuvenation and part of wellness. So they don't really necessarily want to look like a role model. Yes, there's a beauty fandom trend, but generally speaking, people don't want to look like clones of each other. They just want to look like the best version of themselves.
But the trends are changing.
The market itself is maturing.
The market itself is changing, and even the shifts. And again, this is why I said we need to be cognizant of our patient's sphere of influence. Because if you look at lip fillers boomed massively when Kylie Jenner spoke about having lip fillers. When Huda Beauty dissolved her lips and Molly May Hughes dissolved her lips, guess what happened? The opposite happened. There was a movement towards skinimalism, wearing less makeup, being more real, dissolving fillers, and that's the trend that we started to see in clinic when patients were coming in seeking dissolving and looking more like themselves. And I think that's the upward trend that I'm seeing now. Less is more. Patients don't want massive change, or they want it done slowly over time.
Interesting. Even in Liverpool.
Even in Liverpool.
I love it.
I have a skewed insight, because those are the patients that are seeking me. So I can only speak about my experience in Liverpool. I'm not getting the patients who are asking me to do something that is not in alignment with me, because I'm quite vocal. I'm on social media. People know your vibe attracts your tribe. If I kind of put out there that I do anything and everything, maybe it's different. There are practitioners, there are dentists, not in the UK, but in actually in Africa, where they chisel women's teeth into little sharp pegs, fangs actually, because that's what's deemed socially attractive. Now, us in the West look at them and go, oh, look, what are they doing this backwards? But so is that harm, or are they just doing what that patient wants that will enable them to prosper psychosocially within their culture and have
you seen that trend of people using a black marker now to put in the middle of their two front teeth, because now gaps are in fashion?
No, I've not seen that.
It's a massive TikTok trend. They're getting a felt tip pen, drawing the middle, so it looks like.
Or did you see that one in Japan where they're bringing on malocclusions because it's...
because crowning is deemed...
You look younger.
Well, so where do we draw the line? In China, you know what they do in China? In certain areas of China, they crush women's feet because having small feet is deemed socially attractive. Yeah. You can keep going and going. In certain areas in Africa, they put rings around women's neck to elongate them because that's deemed attractive. So where do we draw this arbitrary line? It's going to change according to culture, social construct, social norms.
I'm going to say it's interesting, right? Because obviously you grew up within like Middle Eastern culture like me. I hated, Payman knows this already. Yeah. I hated my body growing up because I was told the beauty standard was you shouldn't have hips, you shouldn't have curves.
Really?
Yeah. And I grew up also like in a massively like Western environment, and when I went to university it got really bad. That was the Kate Moss era.
Yeah.
And I got scouted for modelling, and when I did, all the girls were like, well, you need to lose weight, you need to lose this, but you're not high fashion, you're not Kate Moss, and it was awful. And my mum, unfortunately, bless her, I love her, and she didn't know any better, also grew up with that narrative. She grew up in Lebanon, Western culture. Having a straight body was deemed to be what was beautiful. So for me, I spent my whole life hiding my hips, hiding my legs, hiding like the lower part of my body. And then Kim K came in fashion, and guess what?
Yeah, everyone wants it.
Everyone wants it,
Yeah.
But it's the effect that it had of people telling me basically that I wasn't beautiful enough never left me.
Yeah.
So even though she made it fashionable, I still didn't learn to love it. It's just something that I've learned to live with, sadly, as much as I wanted to say.
Confidence crisis caused by sphere of influence.
Yeah, and that's the thing, because
your eyebrows too, right?
Yeah, I got bullied for my eyebrows. Luckily, I fell in love with my eyebrows because I'm like, I mean, people used to say, and I remember I came back because again, it was Spice Girls era. Yeah. I went into school one day and my mum was mortified because I pretty much shaved them off and penciled them on because they'd made fun of me for having big, thick, bushy eyebrows at school. And, all the girls. And now I'm like, I love them. And if anyone says to me, social media is a funny place because someone posted underneath my TikTok the other day, I hope you can afford to get your ears pinned back now. And I was like, I love my big ears. Like, that's it. Like, I love my big ears.
Unbelievable.
It's funny because things change all the time. Thin eyebrows were in the 90s. Everyone wants them thick now. As you said, it always changes. So I think we've got to be mindful of those trends. Yusra, next question I want to ask you is about motherhood.
Sure.
So talk to us a little bit about, you already described that, when you first fell pregnant. Talk to us how motherhood has changed your life and how you have navigated being a mother as well as a businesswoman and entrepreneur.
Wow, great question. So I didn't plan my first child. When I had my...
How old were you?
I must have been 27.
Okay.
Something like that, 27, 28. And what had happened was we were living in South Woodford in London. My husband was a registrar in psychiatry. I was doing Max Fax. We were both hospital jobs, making rubbish money, barely making ends meet, living month to month. And then our landlord put the rent up and we couldn't afford it. So we moved out and moved into my old bedroom in my parents' home thinking, okay, we'll stay here for 6 months, save up and move out. And then I fell pregnant. And it was, at the time, I thought it was a catastrophe because I thought, oh my God, my career is just taking off. I'm juggling so much. I started doing fixed ortho. I felt like I was not ready to be a parent yet. And actually what I realized is you're never really ready. And so anyway, I had the baby and he is probably the best thing that ever happened to me. He's given me perspective. He's my source of comfort. It's amazing being a parent. It's been challenging because the reality is no matter what anyone tells you, your life does change because it's no longer just about you anymore. You've got responsibility to be a life coach to this mini human being who's relying on you to lead. So I had to learn a lot and there were sacrifices that were made. And one of them was moving to Liverpool, for example.
How old is he?
He's now 10. He just turned 10.
And you have another one as well?
I have 3.
Oh, wow. Why did I say 2? For some reason, I thought 2.
How old are they?
So I have a 10-year-old, a 7-year-old, and a 20-month-old.
My goodness, you're busy.
Yeah, busy. But, it's teamwork. I wouldn't be where I am today without my husband. I think, you can't, every family unit works in its own way, and what works in one family won't necessarily work in the other. We both work, but we both share the workload at home. He is a child and adolescent psychiatrist, so he's very hands-on with the children. He's amazing at EQ and emotional intelligence and managing their anxieties and concerns, everything. So It's been a challenge because both jobs are 24/7. You don't get to clock in and clock out of being a parent. If your child's sick, you are on call all the time. And if your patient's sick, you're on call. So that, I think, is the challenge. There's no manual for running a business. I've made mistakes running my business and hiring and trying to procure the right team. That's a whole podcast in itself. I now have a new rule of hire slow, fire fast. Yeah. And there's no manual for parenting. But I think self-development has been the only way, personal development has been the only way that I have been able to navigate both, and having a good support system and having a real clear why. Why am I doing what I'm doing? And a vision. So if I didn't have all of those things in place, I don't think I could do both. But I'm very passionate about being a present mum. And I'm very passionate about my role as a leader, an educator, a businesswoman, a clinician, looking after my patients. I'm really passionate about both. And the reality is, if you want to do both very well, you may need to do a little bit less of each.
Yeah, I know. I love that. I think that's what I've got, fear and anxiety around having children, for like losing my identity.
What gives? How do you pull it off? What if something gives? What gives?
First of all, there's always something that gives. So great question, because the reality is there's an opportunity cost. Okay. And your priorities are going to shift. I think for me, what gives is social time.
With friends, family?
With friends. And I guess with family to a certain extent, because, you know, I'm in Liverpool, where my family are still in London. Sleep for sure, right? Like that's a no-brainer. That's a for sure. But you know, Rhona, you don't lose your identity when you become a parent. You just take on a new identity. It's like you already wear multiple hats. You're a host of a podcast. You're a leader and educator in your field. You're a social media influencer. You're a fashionista. You're a clinician. You're a boss. You're a colleague. It's just wearing a new hat, and it's a skill set that you acquire with time. And there is no manual. There's no right or wrong. You just learn to do your best. And I think if you keep showing up as your best self with the right attitude and caring, have EQ. Having EQ is probably the most important thing as a parent. And the things that I want to instill in my children are the 3 C's: confidence, competence, and courage. Competence is probably the least in priority. I don't need my children to be lawyers and doctors and so on, but I need them to be confident that they know that there is nothing that they can't do, and courage to be firm in their value set no matter where they are in life.
I really, really love that, and thank you for speaking about that with such eloquence. I remember that I heard you on another podcast also talking about women that had delayed having children and had struggled. It's something I feel very passionate about for a number of reasons. And I think this invites the opportunity to kind of see both sides, essentially. My father's a gynecologist, so I was brought up having been told that if I did not meet someone before I was 30, it was going to be very difficult to meet someone and have a family. He said it with love, because my father has always been a compassionate, kind, incredible human being. But it was because he wanted to make sure that I had somebody in my life that was going to give me the things that I have in my family. I was very focused on studies, not boys or dating, throughout school. Got to university, and then I was like, I'll find a husband. And for me, I had the Disney image in my head. Someone finds you, they see you in a room, they pursue you, you get proposed to, and it's done. And obviously the reality was very different. I went to university in Leeds. I was suddenly thrown into this extremely white Caucasian environment that I had never been in. I actually was the brown girl that had no experience, and people knew that, had never had a proper boyfriend, hadn't done, any of the things that they had been used to or accustomed to, growing up in the environments that they had. And it was a challenging time. It took me a long time to meet someone. I did. I was with that person for 6 years, and there was always this promise that he was going to marry me. And I thought that was basically my life. I turned 27, and he was a good guy, good family, etc., etc. And he had decided that that's not what he wanted to do. And the relationship broke down. And I went into a bit of a panic mode, and I was like, right, I need to find a husband in 3 years. I've got 3 years now to find my husband, because the thing that I didn't want to do was just have a baby with someone or marry someone for the sake of it. That was like the important thing for me. I wanted to make sure I married someone with values and that could bring up a child in the way that I knew a child should be brought up. So as I tried to pressure myself, I ended up dating some of the wrong men. And sadly, when I turned 30, this is really sad, I don't think I've ever shared this with you, I was like, I'd rather be dead than alive and single at 30 and be known as that girl. And I was suicidal. Like, honestly, like, yeah. So I was so broken, and I had just come out of a really toxic narcissistic relationship, and I was too embarrassed to tell my parents because I thought, I'm going to be single at 30. What's everyone going to think? I'm going to be single at 30. Luckily, I met my incredible, healthy, wonderful partner now. I was 32 at the time, and I think I kind of like given up on the idea. I was just like, what's not going to happen?
Sorry, how old are you now?
37.
Okay.
Yeah. And then my father turned around to me and he said, you need to freeze your eggs.
Okay.
I'm telling you with love.
Yeah.
He has a clinic. I'm in a privileged position.
Yeah.
I know not everybody is in a privileged position, but I was, because I only had to pay the lab fees, which is minor, as you know. And he said, just do it. Because it's a safety insurance, it's a policy. Like, I'm sure your dad is, he's factual.
Yeah.
Eggs are like this in your 20s, eggs are like this in your 30s, get it done.
Yeah.
I had a very, I mean, the process thereafter was very difficult on my body, but the success was really high. I got 19 healthy eggs in one go, which a lot of people... How old were you
when you...
32. So one round, 19 eggs, every single egg was healthy. They're in the freezer, okay? So that for me took a little bit of like stress, and obviously I built my relationship with my partner. We're now engaged, etc., etc. So I have a lot of compassion for women that cannot find the right person, you know, at the time of their life when they're expected to. But I also recognize there are women that put it off because of career, for example, into their 40s, and their chances become a lot lower. I'm not saying it's impossible. I know it's possible, but chances become lower. Chances of miscarriages increase, chances of children being born with defects, all that stuff increases. But I reckon now the environment that we live in makes it really difficult to provide the environment where people feel safe enough to start a family.
I agree with you entirely. And I think, look, there's no rights. First and foremost, you don't start and stop when you get married.
Yeah.
And you don't start and stop when you become a mother.
Yeah.
This is all fear mongering, and there is no substance to it, really. If you want to do both, you can do both. With regards to when you find a partner, that so happens hard. In different times for different people. And I have a lot of compassion for people who are struggling, you know, and I have a lot of patients as well who have made the conscious decision to delay having children because of their career. And now
because they feel they don't have enough money to support a baby, or because they want to do better?
At the right time. I'm building my career and building my name. I can't take time off. Who's going to look after my role? What's going to happen? There's a lot of fear around it. I get it, because I felt like that as well. If I didn't fall pregnant by mistake, I'd probably still be still thinking it's not the right time. The reality is it's never the right time. Okay. I know that now because of what I went through. There is never a right time. And I think what's really important to understand is knowledge is power. And if women understood, like you've got privilege that your father was in that field and could educate you and explain to you. If women understood that the reality, physiologically, biologically, the reality, this is fact, not feeling, is that as we age, women, not men, our ability to procreate reduces. Again, this is biologically correct, right? So then you can make an informed decision in your 20s, 30s, whatever, to freeze eggs. But we also need to understand that even when you freeze eggs,
it's not a guarantee.
It's not a guarantee. So there's two sides to this. There is, well, you might not have found the right partner. That's life, you know, and it's okay. You might choose not to become a mother. That's okay, because your identity as a woman doesn't start and stop with if you choose to procreate. So I think there's so many sides to this, but I think information is power. And I think if more women spoke about it and understood that as they aged, and so many women that I now see who are going through IVF said, I never knew that if I left it to my 40s, it would be hard to get eggs. They're going through cycle after cycle after cycle, getting 1 or 2 eggs. And I think it's soul destroying for them. I see them in their darkest times when they are feeling suicidal, very low. It has an impact on their relationship, their self-worth, their image, their body. physiologically, physically, mentally, we cannot diminish that journey. So if they knew, then perhaps they can make a more informed decision if they had a partner, let's say. But this is such a personal journey for each person that you've got to give grace and compassion, understand, and also, I think, reassurance that it's okay either way. I think, I understand your father saying, listen, this is important. And I'll tell you a little story that I went through. When I was 30, I fell pregnant with my second child.
Yeah.
And I was told she would be disabled. And when I was pregnant, the doctor at the time said to me, it's because you're old. Those are the words that he used.
30.
And I was mortified. I literally, my jaw dropped open. And this is in front of my husband. And as he walked out, and again, he was from the generation.
But past 35, it's a geriatric pregnancy.
So I've had a geriatric pregnancy.
Yeah.
So, which by the way, I find the term hugely offensive and
yeah.
unacceptable. So when I was 30 and they told me she's going to be born disabled, and then blamed me because I was too old, and then told me I should have an abortion, it was one of the hardest things I've ever had to go through. And then when I was 35 and I was told it was a geriatric pregnancy, all of that fear that I had gone through came up again. So I hold a lot of compassion and grace for women going through this, no matter what parts of the journey or decision they make. It's a really difficult time, but I think the answer here is to ensure that we are empowered with information. It's the same with the menopause. I see a lot of women in the menopause who don't know what to expect and feel like when they go through the menopause, that's the end of their femininity. They are no longer relevant. Are you kidding me? These are women who have worked in their fields for years. They are the epitome of relevance.
Yeah.
But they don't know what's to come. They just think that they're going to be this hot, sweaty mess. And so part of the research that I did is called the Menopause Skin Report, was discussing how we need to change the narrative in the industry that actually you don't start and stop with the menopause as well. It's all these life changes that women go through. It's a pretty hard life. You got it easy.
but this is the thing, and I think the sad thing is, I said I get so upset thinking about women because women take, I think of the Barbie speech. Did you ever see the Barbie speech?
Yeah, I did. You're damned if you do, you're damned if you don't.
And basically,
it's
it's very difficult. I might even read it out, but it's very difficult being a woman. And I think, look, we have this debate all the time in the podcast, and he's like, it's not that difficult being a woman now. You're not living in Iran or Afghanistan, and these are the places.
I always caveat to childbirth and children, mothering.
That's it.
You have to, if you crop out mothering.
Yeah. So I think, but you're right. I think people have to make the right choice. I think we're lucky now because actually, when I did egg freezing 5 years ago, no one knew really what it is. And now everyone's talking about it. We had Sarita, Mehi's wife, on the podcast. And she actually owns a company that specializes in egg freezing.
Amazing.
And I think it's great because people are and they're trying to make, one of their pillars is they're trying to make it accessible to women that can't even afford the test, because the test can be really, really, so just check your AMH, check all of these hormones, see where you're at, because you're right, I know a woman that had early onset menopause at 35. So I think, like you said, knowledge is power, but it also does not define you as a woman.
Absolutely.
What defines you as a woman is the choices that you make for you. That is it. It's as simple as that. So I want to move on to something that I think attracted me to you in the start. And I think also I've seen there's been an increase in your following, because clearly a lot of people have been very empowered by the things that you've been saying online with regards to your humanitarian causes. There is a lot of political debate that goes on, obviously, online. Do you think, and this is again a debate amongst healthcare professionals, do you think that political discussions, which I view sometimes as being actually humanitarian discussions, should be shown on healthcare professionals' platforms?
I think the GMC and the GDC have issued a statement that has clearly expressed their opinion on this, which is that as a healthcare professional, you and us, have the right to a political opinion, and to express that political opinion in the same way as every other citizen in the United Kingdom. So that is a universal human right, to express your political views. Now, the way that you do so, I think, is important.
Hold on, did the GDC or GMC define the way you should do it or not?
No, they didn't define the way that you should do it.
You have the right to
that you have the right.
Express.
You have the right to express. Political is one thing, and political affiliations or viewpoints may be nuanced and change according to your proximity, i.e. your sphere of influence, right? And the idea, and what the GDC have said, is that you need to be mindful that not everyone will share the same opinion. And that's life. Like, we all have different opinions. So we have to be able to communicate respectfully. And as healthcare professionals, we are accustomed and learn and know how to treat our patients as colorless. It doesn't matter what color they are, it doesn't matter what faith they are, it doesn't matter what sexual orientation or gender or political opinion or affiliation. It makes no difference to our care for them. And it makes no difference to my care for my patients or my viewpoint on my colleagues. It makes zero difference to me. And I think what I have been discussing online is not a political opinion, but a humanitarian one. When we're talking about universal human rights, these are universal. The Universal Declaration of Human Rights was made in 1948 after a huge, after World War II, when there was mass human atrocity. And the ideology and the reason behind that was that it would become the Magna Carta of man, so that we would treat all people universally. And that means that understanding that we're all born equal, with the equal right to life, the equal right to dignity, the equal right to freedom, the equal right to express your views, the equal right to living in your property. And that is what I have been expressing unapologetically. But when you talk about controversy about that, I have had hate, I have had death threats, I have had threats of violence, threats of rape, threats of sexual violence against me and my children and my family. And it has definitely been a challenge to navigate. But I haven't stopped, because I am firm in my belief and my identity and my role as a human being and as a healthcare professional, that I'm here to be in the service of others. And I was brought up with that mindset. I told you my parents are both in healthcare. But beyond that, I feel a sense of duty to be a voice for the voiceless. And I stand firm against the physical and mental mutilation of all people. And I think that it should never be controversial to say, don't kill children, lest the killers be offended.
I find that super interesting because I find there's a lot of confusion around my identity from people online. And I think this also comes down to an education point of view. I'm Arab, as you know. My father is Coptic Egyptian and my mother is Catholic. A lot of people assume that Arabs are of one type of religion, and that I will get abuse because they think that my behavior online isn't in line with their religious beliefs, and that breeds a lot of hate and division. I'm not as strong as you, so when I get the trolls and when I get the death threats and the names, and some of them have gone as far as to find my sister and my mother's profiles, I shut down. What has shocked me the most, though, is that when I discover, or when I've even had messages from other healthcare professionals, and I think regardless of the statement the GDC and GMC have issued, we have a duty to speak to each other in a certain way.
Agree.
Let's put the political part to one side. Yeah. Sometimes the way I see other dentists or doctors slate each other on forums, on Facebook, to me it's unacceptable. It's like the Daily Mail and the Sun having it out with each other.
Yeah.
And when they take it beyond because they think that somebody with a platform, lots of followers, and they think that we can just handle it. If you can't take the heat, don't put yourself out there. That's the saying. Find that really ridiculous, and I think there is a code of conduct on how we should behave towards each other.
I totally really agree. I think there is a code of conduct, and I think as professionals we should know how to conduct ourselves and communicate with kindness and respect. So there is the online bullying is unacceptable. Simply, purely, it starts and stops there. My statement on that. I do not accept it. But what I also don't do is give it face. I don't give it time. I don't give it airtime. I ignore. But when there's threats of violence, that is straight to the police. There's a clear way that I manage this. And I think here's the reality. Look, whether you have 10 followers or 100 followers or 10,000 or 100,000 followers, you're not going to please every single person. You're not going to be everyone's cup of tea. And that's okay. You can agree to disagree. The beauty of social media is you can scroll right past. So you don't like it, shimmy on past. There's no need to leave negative comments. But if they do, I give grace there as well, because I think that negative comment is coming from a place of weakness or negativity or hurt or pain, and they're projecting. They are unable to articulate themselves. So I give that grace and I ignore. I'm not making it acceptable, but I'm not giving it airtime either.
Yeah, and that's the thing. Do you know where the word trolling comes from?
No.
It's not a troll like the dolls, because I thought it was that. Trolling is a fishing term that when you put the rod and then you like basically bait what you're trying to catch.
Bait.
So basically they say that if you talk or respond to a troll,
Yeah.
you are baiting them. So you shouldn't actually, ignoring is the only way that you should deal with it.
Absolutely. What you feed grows.
Yeah.
So give it no airtime.
What you said is look, I think we need to separate the political
and the humanitarian.
Political humanitarian on one side, and then what you said about dentists arguing about patients on the other side.
Not arguing about patients. No.
But often it's about a case, isn't it?
No. You've got this wrong at all. You've got this wrong. Look, I don't want to get into this debate in particular because of the reasons behind it. But like, for example, if a dentist or doctor is struck off, we don't really know the ins and outs of a case, right? And I'm not saying that person is definitely wrong, but the way they will tear apart the human being, whether they know them by reputation, I'm like, this person could kill themselves.
Exactly.
I've had doctors and dentists being struck off and been in the firing. In fact, I know a doctor that had been in trouble who's a huge humanitarian, with not because of the humanitarian cause, have been in trouble in the UK for, whatever reason. But I'm saying, like, they totally dehumanize them on these forums. It's not fair. And God forbid something happens to you, because we've now been in that position. We've not been in the room with those patients or done this. And yes, sometimes you can argue, but there was a clear breach. But you never know until you're in that person's shoes. And I find that really
even if
awful.
there was, I think your point is right. It doesn't need to be nasty. But on the question of the humanitarian, what I really struggled with is, in this day and age, we all have a voice, right?
Right.
We can all post.
Yeah.
And so in the moment of children dying, for instance, it's incumbent on us to post.
I agree with you.
Yeah, because we all have a voice. I mean, 15 years ago, we didn't have a voice. Only the people on TV had a voice. So I found it difficult, though. I found it difficult too.
Because of fear, right? Because of fear, because of silencing, and because of potential misinterpretation.
Yeah, I don't want to hurt friends and family.
Sure, but how
offend people?
This is what I mean. We have reached a stage that is really dangerous, where we are questioning ourselves whether we can say
don't kill a child,
lest it offends someone.
Yeah.
All children are equal. Article 1 of the Universal Declaration of Human Rights is all people are born equal. Yeah. Equal rights to freedom and dignity, equal rights to not be detained, equal rights to not suffer from violence of any sort. These are universal declaration of human rights that must be applied universally. That means that it's not applied to one sect of people, but not another. And when there is a clear humanitarian issue, what's going on at the moment is an undebatable humanitarian crisis. Oxfam has called what is going on at the moment as the worst humanitarian crisis in its existence. It's undebatable that children are dying in their masses. And they're not dying from just disease. They're being killed by bombs that are being funded by the USA and the UK and Germany. So we have a voice. And I would take it even further to say our healthcare colleagues who are out there, 200 colleagues of ours, have been kidnapped, detained, tortured, threats of sexual violence. I mean, this is well documented. And people are saying to me,
it's fake.
Not just it's fake. I'm too afraid to speak up in case I lose my job. I'm too afraid to speak up in case someone comes after me. And I get that. I understand that, because I have had a phone call from somebody saying, stop speaking about this cause because there's someone on a faculty that you're with that wants us to remove you from faculty.
What?
Yeah. And I sat there and I reflected and I thought,
no.
Yes, absolutely. And actually, I don't know how much I want to talk about this on the podcast, but I was strong, and I said I was firm in my faith, and this is what I mean by I'm now mother of 3. I've got privilege that I own my own clinic, that I don't need that faculty position. I am okay in being in a position of discomfort, and have the courage to say, actually, when we are talking about children, I hear the cries of all children equally. Why don't you? This is shocking to me, and I cannot fathom how speaking up for equality of all human beings is politicized. This is not a political matter. This is humanity. And as healthcare professionals in particular, where we are trained to be humanitarians, where we go into healthcare because we care for others, this is incumbent upon us to speak up for our profession, for our colleagues, for children, for innocent civilians who are trapped. And if you look back 76 years ago, World War II, prior to that, when human beings were being killed in their masses, people were silent, turned another cheek, and stayed quiet because they had privilege. It wasn't them being killed, and they were afraid to speak up. And also, it was legal. So just because something is legal doesn't mean it's right. And if it isn't for the courage of people to stand up against human oppression, there would be no change. And let me just quantify that. Slavery continued in the Western world until the late 1800s. So we're talking about 150 years ago, when there was a civil war between the North and South America, and Abraham Lincoln, who stood up for the liberation of slaves, was called an abolitionist, and he was bullied and he was reprimanded for standing up and wanting liberty of slaves. Women had to fight for rights to vote in the United Kingdom until 100 years ago. In fact, in Switzerland, until 1994, women didn't have equal rights to work. So you sometimes have to take courage to stand up for what's right. And I don't think that just because, you know,
you're going to offend someone,
we're going to offend someone, we should be quiet. And I'm going to go further and say, when you are speaking up for the rights of an oppressed people, what that doesn't translate into is denying the rights of other people. So when women were saying, hey, we want equal rights, that doesn't mean they were saying men don't get equal rights as well. It's not a threat to men.
But
hold on, please, let me quantify this.
Yeah.
When people were standing up and saying black people need equal rights,
yeah, they weren't saying white.
They were not saying white people don't need rights. So when we're saying give equal rights to a set of people who are oppressed and don't have equal rights of freedom and movement and dignity and just equality, that doesn't mean denying the rights of other people who do have rights.
Yeah, it's a really important point, because I think, and very beautifully said, I think that that's the problem, and the amount of gaslighting that goes on.
Yeah.
What people don't know is that my grandfather is Palestinian as well, and again, Christian Palestinian. Again, people assume it's a certain sector. You know, he's very affected, had to flee back in 19 whatever it was.
Yeah. I mean, Jesus was born in Bethlehem, which is in Palestine.
Yeah,
so Christianity, that's the birthplace of Christianity.
Yeah, and the abuse that I've had from dental colleagues, unfortunately, telling me that I should be speaking out in the way that they want me to speak out is crazy. And then on the other side of things, when I am posting about things, like you said, War Child, UNICEF, the refugee camps that I work in every year, they're like, you are a terrorist sympathizer.
Unbelievable.
And I just don't understand it, because I don't understand, like you said, why aren't you nuanced? Two truths can be true at the same time. You can advocate for the life of children, and you can also have empathy that some people may be suffering right now from anti-Semitism. Let's just say these two truths can be true at the same time. But saying that I want children to live is not being anti-Semitic. Does that make sense? One doesn't translate into another.
Absolutely.
And that's such an important point, because I feel that people don't understand that.
The reason is there's almost like an empathy cup. If your empathy cup is full, you just can't empathize anymore. Yeah,
you know what I think, Payman? Partly that, sure. And there's a trauma response here as well. But there's also a blind spot, and there's dehumanization. And we can't diminish or dismiss that. Because this is how all human atrocities happen. It's dehumanization of the other. When you see them as less than, they're less human, they are dogs, they're son of dogs, they're agents of evil, they're rats, then actually killing them is not so bad, right? And I would stand firm to say, and if anybody trolls you and says, actually, why are you standing up for children? These are not combatants. I don't care where that child is from. That child can be from any side of this man-made wall. No children should be killed, period. But where there is a catastrophe, a human catastrophe, where 15,000 children have been killed, how is this a matter of debate to stand up for the rights of these children? It isn't. And if we accept that it is, then we're deflecting and we've accepted dehumanization. And really, I think that is a dangerous place to go, because that is a degradation of the civilized world.
100%, but also, like you said, you're from Iraq. And I do think that there was also this being shown in the Iraq war. The difference is that social media wasn't a presence in our life in the way that it is today. So this sort of dehumanization was going on, and in places like Syria and in lots of other parts of the world. But I think that what we can all agree on is that our code of conduct towards each other with regards to these conversations needs to change. Yeah. You know, and we cannot be there threatening the positions of healthcare professionals as a matter of trying to assert our own projections and our own beliefs. I think that's where we enter into a really endangered place. The other thing that I wanted to talk to you about as well is the kind of language. I want to have an open conversation, as I said. So in the Middle East, it was an interesting time for my parents because my father, as a Copt, was almost persecuted. Like, Egypt was a really difficult place to live under the new government for Coptic people. And so his whole family went to America, and he came here. What I've recognised through my own education and understanding is that there is a real degree of Islamophobia. Now, I'm going to use this word because I was also educated by your sister. And Islamophobia is a word that was created by the media and press, and in a way it instills a view on people that the word phobia comes with that religion. And what she said is that you don't use the word phobia for other religions. So we're not Christian phobia, Jew phobia, Hindu phobia, etc.
Exactly.
And I was like, wow, I've never really thought about that. And I didn't even know if the word itself was offensive.
Yeah.
But from your experience, what do you think has been going on from somebody that has been, you know, a Muslim her whole life, and how you touched a little bit on the Iraq war and how that affected you and what people thought. But I'd really like to understand your experiences.
Of Islamophobia, so to speak. First of all, thank you for acknowledging the word is not right.
Yeah.
And it should be anti-Islam.
Yeah.
I think that, but you know, it summarizes the mindset, which is fear. And fear stems from hate, which comes from stigma and a lack of knowledge, ignorance. Mm-hmm. And I think that comes from, I think the media have a lot to play here. Because if you look at crimes committed by a Catholic white man in America who goes in and shoots school children, the majority of school shootings have happened by white Catholic men. What doesn't happen is people say, oh, look at these white Catholic men. Yeah. Because the crimes of these people don't represent the faith. And you cannot generalize. And the media don't even bring up the faith of the person, right? But when you see a criminal called Ahmed or Muhammad who commits a crime, suddenly it's Muslim terrorist. And that's how it's presented in the Western media. And we have to start to get mindful of these things. This is called propaganda. And it manufactures consent for war and for phobia and fear. And I want to take you back, and I want you to understand that there are 2 billion Muslims in the world. If they were these bad guys, you wouldn't have how many people, how many countries, Arabian countries, you have the whole Middle East, are invading and bombing the Western world. It doesn't happen. You don't see it. And it shouldn't happen the other way around. And in order to manufacture consent, this is a real thing, go and Google manufacturing consent, countries for years and years and years have to remove the moral barriers for people to dissent for war. And to do so, they have to portray the people that they are going after as these really bad, dangerous people. Now, you asked me about my father before. My father is from Iraq. Mm-hmm. Iraq is Babylonia. It's the cradle of civilization. It's where education was first formed. It's the place where there was first written language was ever formed. It's called cuneiform writing.
Egyptians were pretty up there too. With the hieroglyphics.
So cuneiform was the first written language. And Iraq is known to be the cradle of civilization. And so sometimes I hear people go, oh my God, you Muslim woman wearing hijab, educated, doing so well. How come? And I'm like, well, I don't understand your question, because I'm not a deviation of the norm. I am the norm. Education, there is this stigma, and it's a stigma again. And if you look at it in movies, the brown man is always the terrorist. The terrorist. And so when we start to see it and we remove that blind spot, then we will start to understand and see the dehumanization of the brown man or the Arab man or the Muslim man, which has happened for years and years and years, which has led us to the place that we are in now, where there's anti-Islamic sentiment. And it's wrong. And it's wrong in the same way anti-Semitism is wrong. And both should be outlawed. At the moment, anti-Semitism is outlawed, anti-Islamic sentiment is not. So where it stems from was your question. I think it stems from ignorance, fear, and hate. And I think it's incumbent upon us all to start to get educated about it and actually start to challenge what we've been told.
I want to say though, and this is again me playing a little bit of devil's advocate to understand, I think that one of the big problems is that people are using their religion to justify their actions. Okay, and this does happen in Christianity, so I just think it's not as prevalent. So I'm going to give you an example. When Afghanistan banned girls from like being educated, it was in the name of like women shouldn't be educated and we're going to use religion. What's going on in Iran, as you know, is women can't, cross the street without covering their hair, otherwise they'll be killed and tortured, in the name of, religion. And so unfortunately, people have abused Islam, which I don't think is the essence of what the Quran says, but they have taken it. I showed you the other day a very problematic influencer with a big following that was suddenly spewing out that, women's places at home, etc., in the name of what he thinks Islam is. So do you think that people have misunderstood? And as I said, sure, you do get it in Christianity, sometimes saying, this is in the name of this. But I think that you're seeing more of it where people are justifying certain actions or certain ways that women should behave in the name of Islam. So do you not think that's part of the problem?
I think the problem is that we accept the generalization of all people based on the actions of the few. It's the same way. I mean, would you say this to an Irish person on your podcast and say...
Catholicism.
Yeah. I mean, does the IRA represent Catholicism? No, of course not.
Yeah.
And we've got to make that differentiation and distinguish the two. And I reject the concept that the Taliban is in any way representative of Islam. I reject the ideology that ISIS are in any way a reflection of Islam.
Of course.
When I moved to Liverpool, the first place that I ever took my son, who was 2 years old at the time, was to a church where there was a play group. And immediately, Liverpool, I'm in a little white village and it's not multicultural. So I stood out, aesthetically speaking. I cover my hair, not my brain, but, I looked different. And so there was a little bit of a guess fear. This is 8 years ago. And finally, a woman came to talk to me. I thought, great. And the first thing she said to me is, what do you think of ISIS?
What?
And I was gutted. Yes, this is what she said to me.
That's horrendous.
But this has been my experience on many, many times. I remember when I took my 6-month-old son to America, to Texas, because my husband was working there. The people that he was working with, as soon as I walked into the room, were shocked that he's married to a woman who's wearing a scarf. And it was like pin drop silence. And they said, we just want to ask, what do you think of ISIS? And I remember Hassan and I looking at each other and I'm like, they think that we represent ISIS? Are you kidding me? Let's talk about ISIS. ISIS are a terrorist organization that went not into the Western world, that went into Syria and killed who? Killed Muslims in their masses, right? Syria was a beautiful country. That was a tourist destination.
Yeah.
And people were living and thriving. They had a gorgeous life. Doctors, dentists, lawyers, businessmen fled persecution from ISIS, put their children in rubber dinghies, not because they were less than, not because they were pro-ISIS. And when they came here, if you listen to the people who were there, they say ISIS didn't know how to pray. They didn't understand the Quran. They didn't know the direction of prayer. They were not Muslims and they do not represent Islam. And when it comes to education of women, if you allow me to explain, 1400 years ago, when Islam was born, women were given rights to education, equal rights to education, and actually revered and encouraged to be educated and to be educators. They were given rights to work. They were given rights to inheritance, to land ownership, to keep their own name, because you don't start and stop when you get married. Being married doesn't identify who you are. And the Prophet's wife was called Khadija. She was a woman who was older than him. She was a tradeswoman. She was a trader. She was a business owner. She employed him and she proposed to him. Okay, so she proposed to a man that was younger than her, who was her employee. These are all for a reason. These broke the social norms and constructs at the time as a message that this is the norm. This is the reverence of women in society. So this ideology that women should be homemakers is personal preference of whoever this man was. And I've seen this personal preference being discussed by men of Muslim faith, men of Christian faith,
but that's what
men
I said,
of Jewish faith, men of no faith. And they can manipulate scripture because man is corrupt to help propagate their own selves. This is the corruption of man, not and it is not representative of the faith. And racism is when we accept stereotyping and generalization of negative assumptions of a sex or group of people.
Totally. I completely agree with what you're saying. But what I'm asking you is, do you not think it is dangerous that these people are using religion as a way to say, this is what the religion says?
People will always use something like religion to say something. I mean, it's the point you're just making.
I think it's the same as trolling, right? Don't give it airtime.
Yeah.
There's always going to be someone out there who's an extremist in their own right or has an opinion. So, but leave them be. Scroll past. It doesn't matter. What matters is that we're educated enough to not say, that's why there's Islamophobia.
You're right, but you're misinterpreting. Us three are educated enough.
Yeah.
Us three.
Yeah.
Okay, but I get shocked when I came into a situation. I don't want to put her into it. Saying that I'm compassionate about what's going on in the world, the immediate response, as in the conflict, she was, and she's, by the way, white Christian, she said, but I don't want, Muslims are taking over. I was like, what do you mean?
Yeah.
And I was shocked. But she's an educated woman. She's not a stupid woman. So I think that you are assuming, Yusra, that people are as educated as you.
Wait. There is a narrative that's called the Great Replacement Theory.
Okay.
Yeah? which is a narrative the right in America are using and some of the right here. And it's this question of Muslims are coming here and having children and their plan is
conspiracy theories.
Well, and their plan is to have more Muslims than Christians, and it's a replacement. And it's been a tool it's a political tool. Yeah.
But that's a political tool to do what?
To
cause
manipulate
fear.
people.
To cause dehumanization.
Yeah.
Hold on. Once we recognize this, you're right. Yeah. What are you seeing happening in Palestine? They're called subhuman. They're called agents of evil. They're called sons of dogs. There's a dehumanization. And that dehumanization has to be refuted. It has to be, because if we allow that, if we accept that narrative, then we are accepting to dehumanize others, which dehumanizes ourselves. If we fail to have empathy for others, we lose our own self-compassion. Literally, this is a degradation of society. And if people are talking about oppression of Muslim women, again, I refute it. If you look at or that Muslim women are uneducated or don't have equal rights, Taliban don't reflect
of course, but nor does the Iranian government. I mean, Payman knows that.
Neither does KKK. Are KKK reflective?
Of course. But what I'm trying to, I get that, right?
So you tell them, if they say this to you, tell them.
No, it's not even about that. It's the fact that I see, okay, sure, I can tell the person that I don't want to, embarrass her, that really shocked me in this interaction. Yeah. And I did that. Yeah. And I was like, have a look. I gave her all of your arguments. Yeah. But what scares me is that when I meet a lot of educated people that say, but what about this? And it's very repressed and da-da-da-da-da-da-da. And listen, because my mom as well is very passionate about like the history and culture, especially of the Middle East, her being Palestinian Lebanese, and exactly what you say. And I think it annoys me that I see people using the faith to justify this kind of behavior. That's pretty much what I'm saying.
It annoys me too.
It annoys me. It really annoys me.
But the only thing that you can do to combat fear and hate, look, hate is taught, right? So if hate can be taught, so can love. But it comes down to education. Yeah. And you say that they're educated. They're educated in what? Where did they receive that education from? Most of them heard stories. They're not truly educated about history. They're not truly educated. I had this conversation with my financial advisor the other day, and he said to me, but wasn't Muhammad a warlord? as in the Prophet Muhammad. And I said, Anas, what are you talking about? Islam actually says you're not allowed to start wars. There were rules of war. Now we talk about international rules of war. There were rules of war 1400 years ago. Islam says you can't start war. You can defend against war, but you can't start war. You can't kill children. You can't kill women. You can't cut down trees. There have always been these rules of war. Then he said to me, yeah, but what about women? They're not educated in Islam. I'm like, what are you talking about? Women have been revered. Education has been the pillar of Islam for years ago. Arabia is where astrology started, philosophy, algebra. I mean, but people are not educated about that. Most people don't know that the first university that was ever formed was formed by a Muslim hijabi woman in Fez in Morocco called Fatima. That was the first university, and it's a UNESCO heritage site. Don't look at me as a deviation of the norm. If anything, I could do so much more, and it's the women in Arabia that have inspired me. And when you're talking about education, I think they've got skewed education.
Yeah, I think, but they've got bias.
These words like Islamophobia. Yeah, you've got to understand that the alternative to the word Islamophobia is anti-Muslim hate.
Yes.
But why don't they use that?
Because, anti-Muslim hate is 3 words.
You tell me.
Because it's 3 words. Yeah, and Islamophobia is 1 word. Because anti-Islamism, Islamism is different to Islam. Yeah,
Call it anti-Muslim.
Yeah.
Call it anti-Muslim.
Well, but what I'm saying is sometimes these words evolve in that way because of things like this. Also, the ISIS point. If something's been in the news, it's natural to bring it up. Yeah. So today, some Jewish guy in Australia is being asked, "What do you think about Israel?"
Yeah.
Yeah. While the Iraq war was on, some American guy in Buenos Aires was being asked, "What do you think about?" Yeah. So if 8 years ago, when ISIS was really at its peak, it's the way humans interact. Yeah.
Yeah, and look,
it doesn't mean that person was saying you're an ISIS sympathizer.
No,
but it's the way humans interact.
But I understand what Yusra is saying. In the same way, it upsets me that people assume things about my religion and culture just because I'm Arab.
Yeah, but
but it does annoy me because I think it's lack of education.
People don't realise there are Christian Arabs.
But apart from the Christian Arabs, they'll make assumptions about being Arab. And I had assumptions about my father and things I did, and Egypt and Lebanon, and okay, look, listen, if someone asked me to reel off Chinese culture, sure, I'm not well versed with Chinese culture.
Yeah, naturally.
But I just feel I really try hard not to project.
But that's a good point, sweetheart. Yeah, you've got to understand that point. My team, she said to me, when we're talking, we call you an Arab. Yeah. I'm not an Arab. I'm Persian.
People call me Persian all the time.
I'm Persian.
They were like, you're such a Persian princess. I'm like, I'm Arab.
No, hold on. I said, I'm Persian. We don't even speak Arabic.
Yeah.
And then she said to me, she's from Romania. She said, what do you call me? Eastern European. Yeah. So I'm so different to the Lithuanians but you just class us all as Eastern European.
Yeah.
Yeah. Well, so the nuance. My wife is a Christian Arab. Yeah. So I understand exactly what you're saying.
Yeah.
But you don't know anything about Chinese languages, Chinese different foods, Chinese. You don't. Yeah. And people aren't expected to know these details.
You're right. Payman is absolutely spot on. But then what's incumbent upon us is, prior to passing judgment based on feeling, is find out facts.
But that's why I said to you, because when I had a catch up with Zainab yesterday, it was so great for her, and we had a conversation, no defense, and she was like, I want to tell you about this, and I was like, fascinating. Now I know. Now I know. How was I meant to know before? Exactly. And also I didn't even know I was causing offense by it, because I just thought it was a word, you know. So I think the most important thing, and that's why I wanted to have this conversation on this podcast, is we have to have conversations.
Yeah, you're right.
Very true.
I do.
Yes,
I want
absolutely.
to. Conversation is the way. Now, before we move on from this topic,
I also want to say one other thing. You mentioned about homemakers. I want to say, because this is something I feel really passionate about, is I got asked a lot about, how do you do it? You're a mom of 3, you're a business owner, and I see women from all walks of life with different roles. And I have women who come in who are apologetic for their roles as homemakers. Being
really
a homemaker
sad.
is not less than being in the workplace. And it's really important that we make that clear, because that role of raising children
is huge.
Is huge, is difficult, is 24/7, and is a part of the team effort. If the husband is the breadwinner, sometimes the husband's the homemaker and the woman is a breadwinner. It doesn't really matter what works within that family unit. But the idea that the homemaker is less than absolutely needs to stop.
I think that we need to stop bashing each other as women.
Yeah.
I'm going to take men out of the equation, because what I've seen is yes,
women
may get bashed by men, but they also get bashed by other women.
Yeah.
What you choose to do in your life is what you choose to do. Whether you choose to have children, whether you choose to be a full-time housewife, whether you choose to be a career woman, whether you choose to do both, whether you choose to get a nanny, you have to do what is right for you, and we have got to stop bashing each other. We have got to start supporting each other. One thing I want to lastly say about
do you think that'll ever happen?
I'll come back onto that, but I want to bring this point. I want to bring up this point about. Have you seen the film You Resemble Me?
No.
It's a masterpiece.
Okay.
My Egyptian friend Dina Amer, she is a journalist. Okay, so let me tell you a little about this. You both need to watch it. It's an absolute masterpiece. She created a film. She lived in Paris. She grew up in Paris. She understood the racism that goes in France. Huge segregation, huge racism. The day, do you remember when there was all the bombings in Paris? Again, the terrorist attacks, Je suis Charlie, all of that stuff that happened. That night, I think a nightclub had been bombed or something like that. So she was working for Vice, the magazine. Vice called her and said, we want you to cover this. It was the first female terrorist attack. So I don't know. They said that they said she blew herself up. Now, the kind of fake news that was propagating all over Paris that night, CNN, no one knew the facts. Everyone was giving this story. The mother of the female terrorist would only allow Dina to interview her because she said, you look like my daughter, hence you resemble me. They were a Moroccan family, and then when Dina went into the story, she realised that she also was propagating this news around something that was so much deeper, and she ended up making a film about this female terrorist and dispelling it. Now, the beauty about the story is the girl came from a broken home from Morocco. They were segregated and ostracised in society. The father was a gambler. The mother couldn't look after the children. The children were torn apart. The childhood was broken. She ended up in prostitution, in this. Society rejected her, and she was a human being that was a shell of herself. And she got a call from her cousin. I'm in ISIS. ISIS is a community. We can help you. You're going to get love. I'm going to give you love. You're going to have a family. You're going to have a husband.
Yeah.
She didn't join. You don't become born a terrorist.
Of course
you
not.
don't come out of the womb being like, I aspire to join ISIS. She was a broken human being. Yeah.
She was groomed as a broken child herself.
As a broken child. And it's a societal problem. I'm sorry, I'm going to say it.
Yeah.
You might say, because I've heard the argument, but France gave her a chance. France took her in. She should be grateful to France. And you know, it's really scary because when she got adopted, when she got taken in by some of the families, they tried to force her to eat pork. They tried to force her to straighten her hair. You know what I mean? They wouldn't accept her culture, and that's not when she ran away.
How do you feel about paedophiles?
What do you mean? How did that come up? That's
in the same sense that people aren't born paedophiles.
Listen, I think Yusra is going to have some empathy for what I'm saying, because maybe this is the end. Of course, I don't agree with paedophilia.
No, not agree with it, but in that same sense that
I think that some people that come out, they might have been abused as a child. I'm not saying it justifies what they do, but the way that we treat people that have issues allows them to behave the way. But it's the same way that we treat addicts. We punish addicts. Why do people become addicts? It's complex. Right. Gabor Mate talks about this. And I think the notion of people joining terrorists, even what was her name that tried to come back to the country, people that joined
15 years
people
old.
that tried to that join these terrorist organizations, it is not in the name of religion. It's in the name of people being broken and wanting to find love and community.
You're right.
Crazily, you know, there's almost like an oxymoron in it.
Yeah.
And they go and they realize that that's not the reality.
Where can you watch the film?
You can get it, I think, on Netflix, or honestly, both of you. It's called You Resemble Me. It's the most beautiful film I've ever seen.
That's incredible.
And she gives a voice to that person, you know what I mean, which people might not agree with, but I think everyone has that history.
Yeah, I think that this is a really interesting conversation. And I often think about children who come from war, who have lost everything, when they've lost their families.
They're going to breed a new...
What's going to happen there when they've watched their mother and father and brother torn to bits, and the world has let them down in their eyes? They become vulnerable then to manipulation. And so you can see the potential trajectory. Absolutely.
People who've lost their children.
Yeah, I mean, if you lost your child, what would you do, right? These are things that we need to understand as a society so that we can treat the root cause and stop war. Calling for peace should never be a controversy. And I think it's also important that we separate people from the policies of their government in the same way that you are basically telling the story about this woman and how and why she became a terrorist. It's really important to never generalize, and it's important to understand that the actions of the few don't represent the masses of a faith. And that's why we have to ensure that in our society there is no space for hate, there is no space for anti-Semitism, there is no space for anti-Islamic hate, there is no space for racism. And the only way that we can stop wars and we can stop hate and we can stop violence against others is stopping dehumanization and teaching respect and love and tolerance.
And that, I think, really does start also in the healthcare profession. It's really important. And that's why I think my message to a lot of people is that we cannot speak to each other in that way.
Agree.
We could talk for ages. I'm literally like, I can see Rich kind of like peering over at times. Yusra, I also wanted to ask you, I know we kind of touched on this a little bit, about wearing your hijab.
Yeah.
Right. Again, I think it's important to recognize that people do it for choice, because I think there is this misconception. And as like you said, as soon as you're a woman that wears a hijab, you are a certain type of woman. Do you want to tell us about any difficulties or challenges or misconceptions that you faced within your own profession? You've touched on Liverpool a little bit and how people had these preconceived ideas. Has there been anything within the workspace that has made it challenging?
Luckily not in the UK.
Great.
And I actually also worked in banking for a short period of time. I didn't ever feel held back by hijab, no.
Yeah.
And I've been really clear that my decision to cover my hair is a choice that I make as an empowered woman. And I don't think anyone, I have not noticed or been aware of anyone treating me differently in the UK. But when I have been abroad, when I went to my first conference abroad in Chicago, do you remember after VT, did you go to that Chicago conference?
No.
There was a big dental conference in Chicago. When I was there, I was signing up to literally doing my registration. And this man came right up to me and he said, "You don't belong here."
In the conference?
Yeah,
Dentist?
he was a dentist.
And he midwinter.
Say again?
Midwinter conference.
That's the one. It was midwinter conference.
Really?
And he said, "Take that scarf off your head.
Really?
Take that tape." And he just kept going. And I,
Wow.
there's no, I didn't have the toolkit to deal with that. I didn't know how to respond to him. So I just thought, give no airtime. Don't pander. Eventually what you ignore will disappear. And he just continued and continued. And then a crowd was coming around. Nobody stood up for me. And it was just really scary. And then one of my close friends who's Jewish, her name is Claire, basically said to the guy, "Get lost, get away from her." And then he listened to her and he went away. And she stuck with me for the rest of the time. That was probably the scariest experience that I had. And now when I go to Monaco, every year I go to Monaco to a big AMWC, it's the Aesthetics Anti-Aging Medical World Congress. In France, as you know, you're not allowed to wear a scarf in public place in the beach.
Is it a scarf as well? I thought for some reason I thought it was a burqa. So now that it's hijab as well.
Yeah. So every time, and women have been arrested, fined, been forced to take off their clothes, declothe, remove their scarf when they're on the beach. And this is well documented. So whenever we go there, a lot of them want to go to the beach. And, I obviously don't go because I don't want to create a scene.
So this is in Monaco. So does the rules apply to Monaco as well?
I assume so, but I haven't looked into it.
Yeah.
So those are the times that I'm conscious of it, where I know that I may be
exposed.
Exactly. But I have patients who come and travel from all around the world to see me, including patients from France. I always say, separate the policies from the government of the people. I don't want people listening to this and going, "Oh, she's slandering France." I'm not.
Yeah.
These are the realities of the experiences of people who may wear a scarf and therefore demonstrate their faith in countries where it's prohibited to do so. I'm lucky that we are afforded liberty and freedom of choice here. I worry about a day that we might not. I remember when the YSL co-founder, business owner, this is about 10 years ago, made a statement that wearing a scarf is the enslavement of women and that people should be encouraged to pull scarves off women's heads. Those are the times where I thought, oh my God, my safety was a concern. but I haven't experienced.
I think
that,
we're lucky.
thankfully.
The UK is extremely democratic. One of the big reasons my dad wanted to leave Saudi and bring us up here is because of the democracy in the UK. I mean, like this was Saudi, like 37 years ago, you know, so that's not what it is now. Saudi's becoming like one of the most like it places now. But yeah, you know, we're lucky because I think the beautiful thing about the UK, especially London, I love it. You go to a bus stop, you'll see someone Chinese, black, Arab, white, all sitting together. And I love it.
And I think it's important. You know, I think it's important. Even within my clinic, my business manager is Jewish. My skin concierge lady, her name is Ocean. She's Baha'i. My other manager, Lane, is atheist. Some of them are Christian. And we're multicultural, multi-faith.
Same with my
clinic.
clinic.
We all love each other. There's no issue. We have compassion for each other. And the first point at which ever their democracy is at stake, I'll be the first person to advocate for them and safeguard them.
Perfect. Gosh, Yusra, I feel like we could talk for hours and hours. I want to end by asking you what the future holds for Dr. Yusra's clinics. Like, you've won Best Aesthetic Practitioner like 700 years in a row, so we've ticked that. Multi-award winning and etc. But is there anything new, exciting on the horizon?
I just think continue learning every day, continue growing every day. I have little projects in the pipeline, which will be revealed in due course. But just being
this
on
is
that
not
process,
the soft launch then.
No, not soft launch. So genuinely, I'm excited by what I do. Every single day I jump out of bed in love with what I do. I'm lucky. I think us dentists went into it because we care for people, and there's that beautiful combination of art, science, and people. I just want to keep doing that and giving back to the profession and growing and learning until I die.
I love that so much. And what would be your advice for perhaps young dentists that are thinking about leaving dentistry but are scared?
Ooh. Leaving dentistry.
So like in the same way, I guess, the way that you have in terms of like not doing clinical dentistry and focusing on facial aesthetics.
Find your passion and excel at it.
Yeah.
And I think believe in yourself. There's nothing that you cannot do.
Perfect.
Do you think sometimes it's the other way around? Excel at something and that will become your passion. Because a lot of people, they spend their whole time thinking, well, is my passion facial aesthetics? Is it veneers?
Dentistry.
Is it endo? Is it perio? Is it? My advice is get really good at one of them, and it will be your passion.
It's good advice as well. For me, I found something that really the passion came first. Yeah. The passion and the why came before the excelling at it. And by the way, I never. Whilst it's always humbling and nice to be recognized, best aesthetic, whatever, I don't take these awards to actually mean that I'm the best or the best that I can be.
Of course.
That's not how I see it. And I never want to actually consider myself as an expert or ever think that I know it all, because I don't think I'll ever know it all. I've been doing this for 14 years. I'm still learning new things every single day. So, I don't know.
I think the one thing that I'll say about awards, because I have a lot of young dentists that get really upset and so forth, it took me really long time to like everything. Come on, give me a break, universe. But like, I was never, it took me a really long time to win awards. And actually, I remember when I first opened up my practice and poured my heart into it, the only thing I really wanted was to win an award for like the best practice, because like I've done everything. And we went to the private dentistry awards and I was up for like loads of awards and we walked away empty-handed and we had a whole table. And I was so embarrassed. And I called Joe the next day and I was just sobbing to him. And I was like, I'm total failure.
Joe,
I was like, love it. I was like, I'm a total failure. And Joe always says what you say. He's like, I can't deal with like how insecure you are. Like it's
I'm the same.
mad.
I don't go for awards with Enlighten in case I'd lose.
Really?
It's fear of failure is huge, isn't it?
The fact that you actually went for them in itself is very brave.
But the point
courageous.
For an award.
Exactly. But the point is that I always say when I go to these awards because I've been asked to present them or I've asked to be a judge. When I see young people get so disheartened, I'm like, it really doesn't define you. Like, I didn't even really get into a VT practice, nor get a job because people didn't like me. But you know what? That pain, I turned it into power. My pain, I turned it into power because it propelled me forward. So I think, you're right. These awards do not define. It's an incredible achievement. I know, that you don't take them as like, it means that you're the best in the world. But also I recognize how much hard work goes into them. And it's definitely, it's deserved.
Thank you so much.
Thank you so
Thank you
much for
for it's been
coming.
amazing. Thank you guys.
Thank you.
Bye.